So we can move on. So I'm going to skip all of these slides that I have, because my sense is that we get it, right? Like we went through the questions and we kind of understood. All right. So the other thing that we tried to do was compare proportions and odds, okay? And so we looked at z-tests, we looked at chi-square tests, and we said that z-tests are great for comparing proportions. So if you think about in t-tests, we said that if you have one sample, you can compare that one sample to a reference, okay? Now, we have the same situation in the z-test. Say, for instance, you know that among the patients that you've usually seen in this population, right? Okay, let's say you are a medical doctor, you're a gynecologist at Ainke House. Okay, Ainke House is a large maternal health facility in Lagos, right? And you're a gynecologist, and you can see that in general, 25% of the women who come to your clinic have one condition, maybe anemia, right? And I keep using anemia as an example, because that's a bias that I have from my research. But let's say 25% of the population have anemia, okay? And when you compare that 25% to your own sample, you're finding that maybe 35% of your own sample have anemia. And you want to decide whether the 25% and the 35%, are they the same? Or are they meaningfully different from each other? Are they statistically different from each other? That's when you would use a z-test, okay? But if you have two samples, okay, where maybe you have a large group of women that are starting antenatal care, and you randomly assign one group to receive a treatment, and you randomly assign the other group to not receive that treatment or to receive placebo, and then you assess a binary variable at the end, right? Maybe that's anemia again, maybe that is hypertension, maybe they have hypertension or they don't. You can compare the proportions that have both using the z-test for two samples. Okay, and we talked about this before. This is a little different from like chi-square, where with chi-square, you also have two categorical variables, often binary, all right? And you want to see whether they're related to each other. And this is, this part of the slide is wrong. Sorry. So the chi-square, okay, you want to see whether there's a relationship between the two categorical variables, right? And maybe one categorical variable is sex and the other categorical variable is hypertension. You want to see whether in your sample of adults, maybe adults in your neighborhood, are males more likely to have hypertension than females? You could use a chi-square, right? One of the advantages of a chi-square is that it doesn't really care about independence. It doesn't require independence to be valid, unlike something like a z-test. And that's why a z-test is more likely to be used in the setting of a randomized controlled trial. Okay, like we said for the t-test, like it's more likely to be used in the setting of a randomized controlled trial. But if you have maybe a population study where you just go in observational study, you can use a chi-square if you just want to understand the relationship between two categorical variables. Okay, any questions? All right, so let's do the same thing that we did earlier. Will someone give an example of when you could use a one sample z-test? Just an example from your own knowledge or something that you think of. Anyone? You just unmute yourself and just speak up. Maybe something from your specialty as you're sitting in the class, you're thinking about what studies you might want to do. So if you were going to conduct a randomized control trial, in your setting, maybe in your community, in your clinic, what would you do? What kind of things would you measure? That will be binary variables, and you can use a one sample z-test. We're just going to wait until somebody speaks up. Anyone, whether you've spoken today or not. Yes, please.
I guess an example is don't compare, let's say there's a new drug that successfully used in campaign the drugs like 50%. And when you try your own test, the first test and you are getting like another percentage kind of and to do that you need to have the one change the proportion of 50%.
Yeah, that's an excellent example. There's a drug that successfully heals a condition, maybe in a certain proportion of the people, maybe it's in 50% of the people, and you're trying it in your own setting, right? And you find another proportion, and you want to see whether the proportion that you find is meaningfully, significantly different from this reference proportion that people have found. Excellent example. All right. Somebody else wants to give us an example of where you would use a z-test for two sample proportions. Anyone else? Yeah, go ahead. Anyone?
Perhaps in randomized control trials.
Okay. Okay, one after the other. I think that there's two people, one. Oh, so you want to go first?
Okay, I said it in randomized control trials.
In randomized control trials. So give an example of a randomized control trial that you are thinking about.
Let's say there is a particular drug that works for a particular disease. Then you want to use it for, like, there is a group with intervention and there's a group without intervention.
Yep, that's exactly.
So when you want to compare, yes.
And you compare the proportions at the end. Okay, that's the setting in which, excellent. That's the setting in which you use a z-test. Okay, all right, let's keep going.